Experts speculate that by 2020, there will be between 26 billion and 100 billion connected devices. So while we don't have the statistics of exactly where healthcare devices will fit into that number, we can only imagine that it will take a huge chunk of it with the aging population alone. So this next talk is quite apropos for this. So, top 5 trends in building a thriving Internet of Health Things business. I want to introduce Dr. Joseph Kvedar. He's the Vice President of Partners Healthcare System, and under his 2 decades of leadership, he has launched a number of innovative mobile health programs, virtual care initiatives, and clinical research programs for more than 1.5 patients. So who better than this to deliver this talk? Let's welcome him to the stage. Thank you.
Well, the Internet of Things is really already in our lives, whether it's the Amazon Echo or perhaps the Nest thermostat or any number of experiences you have undoubtedly had with your mobile device when you enter a retail establishment and they flag you down and message you and share with you various purchasing opportunities because the phone knows you're in the establishment and the app knows. Those are all IoT applications. And one of my favorite quotes is, "The future is already here. It's just not evenly distributed." That's William Gibson. And IoT is like that. So you can now start to not just speculate on what this, but really think about what it really means to us. And it means a lot, I assure you, to healthcare delivery as well. And that's what we want to focus on for the next few minutes. So having realized that, I was inspired to put this book together. We put this book out about 15 months ago, and during that time already, there's been a number of advances in the space, and that's really what I wanted to share with you this morning, not just what we wrote about, which I'll summarize in one slide in a moment, but how it's starting to move forward. So in essence, if you can boil it down to one slide, this is about the Internet of Things part is all about the richness of data that we all generate now on a daily basis. Think phenotypic fingerprint, or if you like the idea of genetics, phenotypic mapping. It's that part of the big data equation that's growing by leaps and bounds because of all the connected devices around us, on us, in our pockets, etc. That in turn will enable really fine analytics, and analytics previously was 100 people like Joe could do something, so maybe Joe should be recommended that same thing. We're talking pinpoint analytics, where I know who Joe is and is different than everyone else. And then finally, the engagement piece, which is really about the psychology of motivation and inspiration and personalization. So I think it'd be a great book for you to read. I'm biased, I know. But in the meantime, let's talk about some of these trends. Now, I have 5, and for several of them, a caveat. So trend we'll talk about, then a potential caveat. And I'm going to spend a little more time on the first one because we have some interesting data we just generated on this. And that first trend is about the difference in new wearables and how, well, on the one hand, you all know that wearables are now at the bottom of the hype cycle, right there in the trough of disillusionment. And that's largely because the first generation of wearables that we produced was really about numbers, right? And I happen to be a very quantitative person, so I was pretty happy. But I learned that most people are not, and that's why you have this notion of the Fitbit ending up in the drawer, because it's not that interesting after the shiny new toy effect wears off. So we're starting to see a new generation, though, of wearables that measure interesting things, but don't report those things. They report something that gives you insight. And I'm going to talk about 2 of them in detail now. On the far left is the Spire. So hang with me because you're going to go through the study with me here. The Spire is a device that you wear on your belt. It measures respiration, really boring tracing, but it reports out on stress and focus. So you're wearing this thing and you're getting feedback of when you're stressed, all right? So that's the Spire. On the bottom right is the Muse. Ariel Garten, the founder and inventor, has been at this very conference talking about the Muse in the past. The Muse is a head-worn band that measures EEG. Now, once again, unless you're a neurologist, EEG is a pretty boring tracing. But it reports out on calm and focus. And so we looked at these two and we thought, well, are they doing the same thing or are they doing something very different? Respiratory rate, EEG, and we decided we would compare them. So we recruited a cohort of people. We broke those people into two groups, randomized them. And here's how it worked. For the first, everyone had access to the Spire. So for the first couple of weeks, we measured people's stress levels without turning on the feedback, and then we turned on the feedback for everyone. So every participant had the Spire and the feedback of when they were stressed. Half of the people got access in the middle of the study to the Muse and were encouraged to do these daily meditation routines that the Muse provides. Here's how it works. So this graph shows that everybody was more aware of their stress. So in some sense, maybe that just proves that feedback loops are doing what we think they're doing. Everyone who had the Spire device, because that was what was giving them stress feedback, had more notion of stress, both groups. So maybe not so surprising. Now, people who had the Muse, however, and this is a comparison of Muse and Spire on stress resilience, people who had access to the Muse had significantly more stress resilience at the end of the training than people who did not. And one of the nice things, by the way, about these devices is you can really zone in on who is engaged with the technology. So the people who were heavily engaged with the Muse had significantly fewer stress episodes in a day at the end of the study. So it appears as though the Spire does give you feedback on stress. The Muse helps with stress relief. And we just thought that was interesting. And again, just to leave this trend, it's this idea that we're going to get more and more wearables that are giving this kind of insight as opposed to just numbers. Trend number 2 is easier data capture. And this is happening. There's two examples here, Validic and Human API, that are doing these sort of API farms, if you will, to get data into the clinical environment easier. That's a big problem we as clinicians need to solve. Apple, of course, has their series of Health Kit, Care Kit, et cetera, Research Kit, and Samsung is trying with, Google rather, is trying with Google Fit, but not quite there yet. So we're not quite at the time where we can say everything goes through the mobile device, but we will get there. Now the caveat is, it's still not frictionless for the patients to set these things up, and we need to make it so that the data upload part is just happens. And then we can concentrate on engagement. Trend 3 is really interesting, which is pharma embracing these technologies in various ways. When we started working with them years ago, it was about digital is another channel to do direct-to-consumer marketing, right? We're way beyond that now, where people are starting to think about opportunities for digital to embed within the mix of therapeutics, be a wraparound for therapeutics. And there's even some examples, we've shown, there's 2 here, and others, that certain programs and tools that are digital can rival chemical therapeutics in their efficacy. Omada Health is one example of that on the far left. One in the middle that we did is Feet Forward, which is a collaboration with Samsung to show that a digital app and a wearable can rival the drug metformin in the care of diabetes. So there's a lot of interesting work in this area. What's missing? Well, the business model for pharma is still quite strong. Molecules make a lot of money. Software makes money too. So we'll have to see how this journey goes over the next few years. Trend 4 is this notion that we're not talking about big data anymore or even machine learning. We're talking now about AI. And as I said earlier, it's really in our lives now. The Amazon Echo really did that for us. It brought it into everyday life for people to see, touch, and feel and understand what AI could really be like. And more and more and more of this will fit into healthcare. And the idea, of course, is that most of what doctors do probably is better done by machines. And that way we can save the really, really complicated relationship work that we should be spending more time with our patients on for us and leave the rest to computers. What's the caveat? Well, doctors are pretty afraid of this actually, because they feel it's a little bit threatening to their livelihood. So we'll have to work to reassure them that we won't need less doctors, we'll just be employing them to do things that they're better suited to do. In fact, my last trend is about docs, and the idea here is that docs are coming on board, which is really exciting because a year ago, I really don't think I could have said this. Most of the energy around telehealth and connected health by the MD community was negative or neutral or dismissive. Now, it's not perfect. In fact, this is data from an AMA survey that was done a few months back, 1,300 doctors. And on the one hand, 80% of them had some issue, like liability or data overload. Those are common. Reimbursement's a favorite. Those things are actually being solved. But let's go to the glass half empty side of the data. 45% saying they would be open to some sort of digital health solution in their practice, and 12% having adopted something. Now again, that sounds small, but like I said, about a year ago, I couldn't have said that. So the tide is turning. I see it in my own organization, and then when I go out and speak to doctors, this is no longer something they dismiss, but something they're looking for. How do I integrate this into my practice? So that's trend 5. So in essence, the Internet of Healthy Things is upon us in small doses. You can start to see how this is moving forward. And these 5 trends give me excitement that this vision will come to pass in the next few years. Thank you.